Roll.
Chairman Mills.
Present.
Present. Vice Chair Barrow. Senator Boudreaux. Senator Carter. Senator Hinskins. Present. Senator Luno. Present. Senator McMath. Present. Senator Mizell. Present. Senator Pope. Present. 6 members present.
Thank you very much. And Senator Fessy, thank you for joining us. We appreciate you sacrificing your time to be here. Thank you very much. And you're part of the committee today, so make yourself at home. Thank you very much. For the audience and the members and everyone here, just to kind of lay out the format that we see for today's meeting, what we'll do is we'll let the we'll allow all of the legislators an opportunity to address their concerns and the reasons that we're here, and basically the impact maybe in their districts. So I think they'd like to talk about that. We'll have an open dialogue between the department and the legislators during that phase of it. Then we'll turn it over to the department for any rebuttal, any comments, any action plans, any next steps. We'll go from there. And then the third phase will be, we'll also turn it over to the public for any comments that they may need. So if the public is here, you will get an opportunity to testify. And then the goal of this committee is, once we do identify next steps, action plans, we'll meet again. The president has assured us that he'll provide us those resources. We'll meet again just to see how follow-up is going, so that the public will know that between the department and this committee for oversight, we've got an action plan and next steps. Just to get the committee members up to speed, this document was prepared by the staff. It's a response that the department did send out to the Senate Health and Welfare Committee. A letter was drafted by myself, the pro tem, and Chairman Bagley, just addressing some issues, and it's all addressed from policies, procedures, and challenges that the department sees. And it also has a lot of good statistical information on how many employees are there, what the attrition rate is, and where we go from there. So to get things started, I'd like to call on the pro tem of the Senate, Senator Mizell, for your comments. And then any of the committee members, if you'd like to speak prior to anything else, just please indicate your light and have your light on, and then we'll go from there. Madam President Pro Tem, the floor is yours.
Thank you, Mr. Chairman. I just want to thank the chairman for and his staff for making this possible. I think it's really important that we have an opportunity to share the concerns that we've seen. I want to make it really clear. We were here 2 years ago, and we started a conversation. I think this picks up where that conversation left off. Some tragedies have happened that deserve a real heavy and thorough look at how we can do better with the children of our state. No matter how hard we try, they deserve that we do better. And I think this is an opportunity. It's difficult for people who have concerns about this to express those concerns, because there's no forum really available for those concerns to be expressed. I know many of my colleagues get emails, they get calls, and we want to take it a step further and see how we can put some action behind improving the outcomes for the children of our state. And if I could just say, I want to thank the department. I know that they are working hard, and I don't believe anybody doubts that they are working hard. I think that there's probably an opportunity now to look at things with some fresh eyes to improve the way we move forward. And I want to thank the chairman for the opportunity. Thank you, Mr. Chairman.
Thank you very much. Any other committee members? Senator Fessy?
Thank you, Mr. Chairman. One of the things I would like to bring up and get things answered on is what happened to Ezekiel in Terrebonne Parish a little while back. And so I got a bunch of questions on that, or where we missed the ball and how we missed the ball on saving lives. I was told that approximately in 2021, we had 55 children in the state of Louisiana die in these situations, and now we're already up to 35 or plus in 2022, which is 20+% increase. And finding that it's related a lot to parents on drugs. And so I think we got a lot to accomplish in figuring out what we need to do in that relationship between parents on drugs and harming their children. So I'll have a lot of questions on that in the future, so we'll work in that direction. Thank you.
Thank you, Senator. Senator McMath.
Thank you, Mr. Chairman. And again, thank you for putting this together. The reason that we're here is obviously frustrating and unfortunate. And it's not just one case or two. We've been seeing this. This is my third year in this position, and this is, I don't know, 3 or 4 of these that we've had, either in session or out of session. I've been weighing, sort of what my position is going to be, just given the input that I've gotten, given the stories that have come across my desk, and taking into account like the political realities that we're facing, and trying to be as pragmatic as humanly possible. While I think there's been systemic failure, and I understand the reasons that have been given over the course of the 3 years at least that I've been here, and in terms of budget cuts and retention and just how difficult the job is in general. You're still in the position that you're in, Madam Secretary, and I'm still in the position that I'm in. And, children are dying. I don't think that there's going to be, again, going back to the pragmatic aspect of my thought process, a change that will solve the problem. And I think that a significant overhaul does need to take place. This was just given to me as we were sitting here, and I don't know if it came from you all or someone on this committee, while Alabama's child welfare system is among the nation's best, which is great. This is from 2014. It's 2022 now. So while I would be wholly in support of significant overhauls that have to come down from this administration, quite honestly, I don't see that happening over the next 18 months. So what can we do to try to keep the ship afloat between now and then? And that's what I want to hear from you all today. I want you to articulate some sort of wellness plan, or some sort of plan of action, because we can't lead or help you guys lead if we don't know what the plan is, and if in fact there is one. So that's, while I wish we were in a little bit of a different position here. I'm just trying to take into account, again, the political realities that nothing is really no major changes are going to take place between now and 18 months. I have a feeling that's going to be the case. So accepting that political reality, how can we listen to what the plan is and help you with that plan, so we stop losing lives and we stop having children that are raped by caregivers, because that's what's happening. So I look forward to listening to not only the input from the members of this committee, but from your department as well, and from the public. And I am probably going to be hitting the green button 1 or 2 more times, just so we can have a real conversation. And I appreciate the chairman's acknowledging that this is just the first of many, because we got to get to the next 18 months. So without losing lives. All right, with that, Mr. Chairman, thank you.
Thank you very much. And committee members, we want to make this a discussion where we go back and forth, so it's not like we're debating a bill. Let's have that discussion. Senator Carter, on that note, it's all yours.
Thank you, Mr. Chairman. I was looking at many of the materials that's in front of us, and one that struck me is the fiscal year-to-date performance, the authorized TO positions from fiscal year 2004 up until fiscal year 2023. And it's a drop of almost 1,500 authorized positions during that period of time. And I think if I'm looking at this chart correctly, I think there's a change in your fiscal year budget of 32% from fiscal year 2004 up until fiscal year 2023. I know that money doesn't solve all problems, but to the extent there's some fiscal issues going on that we need to fix with the budget, we need to know that and discuss it. It's my understanding that there's high turnover, there's problems retaining staff. If that can be addressed fiscally, those are the sorts of conversations that I think is very important to have, because if I'm looking at showing that your authorized positions back in 2004 was 5,325, and then we're looking at today a number of 3,634, and those are authorized positions. So that's not even dealing with whether or not there are any vacancies within that authorization. Just because you're authorized to have 3,634 doesn't mean you actually have that many employed. Just like but in 2004, you were authorized to have over 5,000 and money in the budget to accomplish that. So as we have this conversation, I certainly want to know, while the state has the resources that it has, how can we look at solving these problems from a fiscal standpoint, if that makes sense? Thank you, Mr. Chair.
Thank you very much. And you're laying a lot of the groundwork of the discussions. That's great. Senator Luno?
Thank you, Mr. Chairman. You know, of course, there are several issues that we all want to discuss here, and one of those is one that Senator Carter just hit on a minute ago. Is I'm looking at the number of people you have and the budget you have and that sort. I chair labor, and so we deal with these issues all the time. We had one person that came to committee last year and said they didn't need a single person in their industry. Every job was full. Now, that was the only person I've ever heard say that in the last 3 to 4 years in the state of Louisiana. And from looking at this chart, it's pretty obvious that isn't the issue with you. So that is one of the things that I would like y'all to address, what effect the decrease in the number of employees has had, as well as the issues dealing with the budget, because we can see the roller coaster effect of the budgeting and what's happened since about, I guess, the 2010 session on forward. So that I would like for y'all to address that as well. And then finally, we compare ourselves to other states all the time. So I want you to compare us to other states and tell us where we're doing good things and where we're doing not so good things. And so I do, like Senator McMath said, I think we need to take an overall look at this, because I don't think there's a single problem. I think that there's lots of issues, lots of problems. Some of these things we couldn't avoid. Some things were avoidable, and we need to make sure that we have a fix in place for those as well. All right, thank you.
Senator McMath?
Yeah. Sorry, I told you I'd be hitting the button a couple times. In the spirit of Senator Carter, lost me. There you go. In the spirit of what Senator Carter is referring to, and Senator Luno, if you had, when you have an opportunity to discuss this, if you have all of the money in the world, right, and you don't have any budget problems, in a perfect world, I want to hear what the plan, if you had that money today, what is the plan to, with all the resources that you could have, to address the child deaths, the unfortunate incidences of rape and abuse, how we can get foster parents engaged in the process again. Just in a perfect world, let's pretend that you've got all the money in the world. want to hear what that plan looks like today. Okay. And you can let us know how much that would cost too. But just, I mean, I'm really more interested in what the leadership, what we're going to do. What's the plan? Okay.
Very, very good. Representative Hughes for comment?
Good morning. Thank you, Mr. Chairman, first of all, for your graciousness in allowing me to join, and to the staff at DCFS. Good morning to you all. Madam Secretary, as you know, I've, over the past several weeks, expressed some pretty direct views about my opinion of the direction of DCFS. It's nothing personal. I want you to know that I like you personally. I will reiterate that, I feel you've been in position now for 7 years, and I do feel that there needs to be a new direction. I won't harp on that out of respect to the Senate today. But as we go throughout this hearing, I would like you to address, I keep hearing about the money issues, but what we're not talking about is the morale within the agency and why when people are hired, they don't stay. Over the past 3 weeks, I have gotten emails from current and former staff pouring their hearts out, asking me not to share these for fear of retaliation. And so, we can hire people, but if they're not treated well, that's a problem. We can hire people, we can say we have an open door policy, but if people are telling me that when they express their views, they're being retaliated against, that's an issue. And so if we can talk about the culture of fear and retaliation, and over the past 7 years, what has been done to prevent those things would be appreciated. Mr. Chairman, thank you for your leadership, and thank you to the members of the committee.
Thank you for being here, and this is going to be a wide open dialogue between the department and the legislators, so we'll continue that dialogue. Senator Hinchkins?
Thank you, Mr. Chairman. I appreciate it. Madam Secretary, thank you for coming today. There's a lot of issues on the table today, and this department has had a bunch of friends up here over the years. We've fought in appropriations to put money back for you over the years, many a times. But we question the leadership now. I mean, I've heard you say that work is complicated. It is. I heard you say, I hope no one's losing faith in the department. They are. And when they're losing faith in the department, it needs leadership to turn it around, not just say, I need another $10 million in the budget. That's what I want to hear today. What are you going to do in the next few months, in the next 18 months, to prove to us that leadership is there and capable of doing it? So thank you, Mr. Chairman.
Thank you very much. The President of the Senate has joined us, and I want to thank President Cortez for allowing us the opportunity to meet, the resources you help provide us for, and I know your goal is to make sure that we do the best work we can for the children of Louisiana. So we'd like to turn it over to you, President.
Thank you, Mr. Chairman. First of all, thank you for being here. This is not the first time that the Senate committee or the House committees have had to be convened for the purpose of carrying out their duties, their sworn duties of oversight of the executive branch agencies. Earlier this term, we had it on both sides. The House and the Senate convened committees for the same purpose, with the goal always to be to have the best agencies in the country. We want to be the gold standard in all of our agencies. This agency, it's no, I mean, I don't want to repeat what everyone said, but it's not missed by the public that this agency has failed and had missteps along the way. I'm one of the few people, along with Senator Pope and Senator Mills, that were here during the general administration. I believe Senator Pope may have been on appropriations with me at the time. And we recall a lot of the funding changes that occurred back then when technology was on the rise, and technology took over in large part for people because you didn't need a person to sit there and write an app when you could fill it out online and things of that nature. And so I'm sometimes a little bit dumbfounded when I hear that the agency doesn't have the resources, that the legislature didn't allocate the resources and the funding priorities, and so I'm concerned that can be somewhat misguided when we want to go back to, planning and budgeting and request what the requests were from the agencies, because it's my understanding, and I want some clarity on this as we go forward, that over the years, since we served on appropriations, I don't recall that the legislature cut budgets that were recommended in the executive budget without a reasonable request and dialogue between the agency and the legislature. So with that, I have made the commitment to Senator Mills and to the chairman that this committee do everything in its power to find solutions. We're not here, this is not a witch hunt. This is here to find solutions to make the agency, like I said, one of the gold standards in the country, much like we did with the conversations relative to state police earlier in this term. So with that, I appreciate the committee members being here, taking your time to be here and participate. And I know that many of you have been sitting and hearing these conversations. Those of you who are on the Health and Welfare Committee are hearing this on a regular basis, and your constituency has concerns, and hopefully they will be brought to the table today. So my commitment to you, Mr. Chairman, and to the members is that as many times as you need to meet and as much staff as you need dedicated to getting those answers, that they will be here. And so I appreciate you putting this together, and thank you all from the administration, from the agency, for being here today.
Thank you, Mr. President, and thank you for being here. Just a little house cleaning is Senator Barrow really, our vice chair, really wanted to be here. In fact, she called me during the weekend several times just to discuss kind of things she'd like brought out. One thing, she wanted civil service to be here. She wanted to hear some testimony from civil service. And for the vice chair not to be here, we wish her well, because it has to be killing her not to be at the committee hearing. I know she wanted to have this dialogue. As chair for Select Women and Children's, she had a good hearing that we started the process, we started the dialogue, and this continues it. Another committee member that asked me to put something in the record is Senator Boudreau. Senator Boudreau, as we speak, is in Rome, and he's going to have an opportunity to meet the Pope. So he's in a much better place today, I think, than us. But he'll be praying for us. But he did want me to put into the record, and I know the department, I know who this is, but he said he wanted to inform the committee members that Judge Tommy DePlanche and he have discussed the staffing and program issues in the Acadiana area. And I know so many of you know Judge DePlanche and his good work. He has pledged the resources in his office to assist DCFS in any way possible. So he wanted to put that on record and to let everybody know that. And I see so many of the staff members shaking their heads, knowing how Judge DePlanche really works well with everybody, and he's got a heart for children. Be it on that note, I do want, before we start the discussions, on behalf of the committee, I do want to thank every person that works at DCFS, that gets up hard every day, works hard, makes a difference, because we're in a tough environment for any occupation right now. The way COVID has dealt us a crazy hand, and the way that society has had to deal with the pressures of COVID in life, you have a tough job. And for the people that are working in that department, this is in no way to bash you or bash your morale or to bash any of the things you do. This is just an opportunity for us to be better. That's what this is for. And when you put collective minds that have the same goal, you reach those goals together. So what we're going to do is we'll start the working dialogue with the department, and we'll kind of take some notes, and hopefully we have an action plan. But I guess before you start the presentation, I did want the committee members to know that in this yellow-bound book, the first portion of the presentation basically is a response from the department, and we had a lot of questions that Senator Mizell and myself and Senator Bagley had Ms. Cannon put together, and the response is very detailed from the department. They bring out the policies, the procedures, the timelines. But one of the things, before we maybe get into a more formal presentation, I'd like the staff to maybe talk about from the department standpoint is, it looks like over the years, from the dismissal and the reasons for separation, A lot of it is a large percentage is personal reasons for resignation. A lot of it is for reasons not stated. If you just look at fiscal year 22 as of now, the reasons for pay are just 7.8%. So when you look at where the pay is, you look at the regional averages, you look at where things are, it looks like there is kind of been systemically, not just for 2022, but in 2021, the same thing you had. You had 34% of the staff resign for personal reasons, 15.1 resigned because of not stating those. In 2019, you had resignations for personal reasons at 49%. And just, can y'all address, let's start on that aspect, because what was brought out in the select committee was training is a very tedious process. And you know, when you can't retain staff, that becomes even more problematic. But can you address the reasons for resignation, the reasons for people leaving? Because I'm sure you must have an exit meeting of what was the reason you left. So can we maybe start addressing that? And then once we finish that, if there's no questions by the committee, then we'll turn it over for your more formal presentation.
All right. Good morning, everybody. Marquita Garner-Walters, Secretary of the Department of Children and Family Services. And I sincerely want to say thank you for this hearing. I truly believe that as the oversight committee of this agency, we should be in more constant dialogue, and that we should be meeting closely and more frequently. So let me say that. I will start, and then I will turn to Dr. Hodnett for specifics, but when we do our exit interviews, what we hear consistently over and over and over is, I don't have work-life balance. I go home late after having a long day, and I still feel the burden of my caseload when I go home. I neglect my family because I'm worried about the kids in my caseload. Excuse me, I can't get to everything I'm supposed to do, and that makes me nervous, anxious, scared, frightened, worried about my license as a social worker. I feel a burden that I can't let go of. And I don't know how to be more clear or succinct than that. When we are working people beyond their capacity to feel like they're doing good work, and that they are anxious because there aren't enough hands on the plow to do the good work that they're supposed to do, that they want to do, that they felt called to do, to come here. Because we are a mission-driven organization. People do come to this agency because they want to serve. They want to help people. They don't come for the pay. They don't come for the glory. They don't come for anything else. They come because they want to help people. And so they feel the burden. And when they don't feel like they're doing a good job, then they leave. And we hear that consistently over and over and over. One quick example, last week, one of our best managers left and took a job as a clerical worker for a construction company, cut in pay, and said, I just need to be able to go home and be with my family and not feel the burden of this work. I just need a break. So I'll let Dr. Hodnett go.
So on that note, what do you find, because it is systemic, the attrition rate, what are you finding out that may be that silver bullet where other states may be, because I know you share information with other 49 states. I know y'all all close as departments, but does somebody have the secret sauce in other states that have basically come up with a better balance, a better way of doing it? Because it looks like it's not just this year. It looks like it's systemic within the occupation.
It truly is. Child welfare across the nation is facing this. This is not a Louisiana-specific incident. If you talk to any child welfare system in the nation, they will tell you they are struggling with staffing. When we get deeper into this, we'll talk a little bit about when we saw this curve really shift was with COVID. But the child welfare system has always been one where staff felt a high level of confidence and assurance that they could do their job when there were enough people to do the job. And I will go back to what Senator Carter said. If you look at the number of staff that we have, and we can talk about how that happened and when that happened, and I go back to, and you've heard me say this before, this is not new information for you, but when I was the child welfare director in 2004 to 2008, when I sat in Dr. Hodnett's chair, I had 500 more people to do the work. 500 more people. It makes a big difference when there are enough people doing the work, that the work is spread evenly, and that the workers feel like they have control over their caseload. But when your caseload is 1.5 or 2 times what it should be because we don't have enough people, then you feel out of control with your caseload. You don't feel like you're managing your caseload. You're not getting to do everything that you know that you should be doing. And so you feel all the pressure that comes with knowing you're not performing at a peak level, and knowing that the difference in our agency when you don't perform your best is that horrible things happen.
Very good. Senator Mizell.
Thank you, Mr. Chairman. You and I have talked about this. So it gets down to the point where we've acknowledged we're way short. We're way short. It's a terrible situation. But what is being done in a very concrete way? As I said, I had a little preschool. Mm-hmm. We had to be a team. We had to uplift one another. Do you feel that's the environment that people have within? And I don't mean in the Baton Rouge office. I mean in the Bogalusa office, in the Covington office, where they're really at the grassroots level dealing with the ugliness every day. Do you feel that there is a team environment? Because I'm going to be really honest. I've gotten letters of resignation that were heartbreaking, where people felt committed spiritually to doing this as a mission, and they had to quit because the internal politics became more than they could tolerate, and they were heartbroken about it. So I know Dr. Hodnett and I had talked about, you see billboards for teachers from Dallas, Fort Worth. We all want more teachers, and there's ways to arrive at that. So one thing, are you building the team with who you've got, and are you have an active outreach to bring in people that would love to do this?
Yes, and I'll say a little more than I'll let Dr. Hodnett say it. In the strategies that we will present, because you're very clear that you want very specific strategies. Mm-hmm. And so we are working with civil service, we're working with the division, we are doing salary pay, civil, I can't think of the word, special entrance rates and all sorts of things to stabilize the salaries because they are low. So we are doing those things. Civil service has been very gracious and has worked with us, and we're going, I think, before the commission tomorrow to finalize some things. So we're doing the pay things that we think we need to do. We are looking at, to Senator McMath's question of how will we do it differently? How can we build it differently to meet the need where we are right now? And Dr. Hodnett can speak eloquently about the changes that we're making that we feel like maybe will help staff feel more supported and less afraid of the work. Specifically, Senator, to the point of morale. It literally, as an executive team, it breaks our heart when we hear about morale issues. I get those letters too, maybe not the same ones, but I get letters from staff. Every time that it is brought to our attention, we go to the region to try to figure out what's going on. Staff works with leadership in the region to figure out where the breaks are. Are supervisors being punitive because they're feeling pressure? Are managers feeling that pressure? I will tell you that right now in every region of the state, supervisors are carrying cases. So they're not able to do the supervision with their staff that they should do. And that puts them in a double bind because they're responsible for the case they're carrying, but they're also responsible for managing their staff. And then that means the manager, so your level is worker, supervisor, manager. That means that the manager is picking up the supervisory duties and probably carrying a couple of cases just to lighten the load of the people in their region. And so with our case counts where they are right now today, it is no surprise to me that morale is low because everybody's doing more than they should be doing and working outside of their job description. Because when you have supervisors and managers carrying cases, I mean, of course they're frustrated. So, but Dr. Hodnett, I'll let you.
Thank you. Rhonda Hodnett, Assistant Secretary for Child Welfare. So I'll be glad to tell you about some of the efforts that we have going on to recruit and retain. So we started with a plan to stabilize Baton Rouge, right? So we know that that was in crisis situation and there were some very specific things that we needed to do to stabilize Baton Rouge. But we had a longer range, more comprehensive and broader plan that really centers around 7 key strategies, and that's what we'd like to review with you all today. Many of these have been going on before, started before these incidents came up. Some have been expanded, and some are new since then to address specifically some of the issues that we've uncovered. So the first one really starts around recruiting, retaining, and supporting our staff and our foster caregivers. The Secretary said it very well. People are exhausted. They have no work-life balance, and it is not a surprise to me either when people say, I can't take this anymore, I've got to resign, and it's heartbreaking. You know, as someone who has been in this work for 35 years, I understand how difficult it is to feel like you're going to have to walk out of the door because you can't do it anymore. But it comes to a point where everything else in your life is suffering, and that's what I hear from people most of the time about why they're having to leave. So recruiting, retaining, and supporting staff and foster caregivers, everything from conducting job fairs, open houses, our partnership with the universities. So we are putting all of those things in higher gear than we have been. That we have a university partnership with 7 universities throughout the state that have schools of social work. And through that partnership, we have internships for students in social work. We also use that as an opportunity to send some of our employees back to school to get a master's degree. That's a partnership that the feds have some funding for, and it allows us to improve the competency level of the staff that we're bringing in. So in addition to that, because we have struggled in the past years, even though it's tuition that's being covered for them, we are struggling to get people into that program. And so we've extended it to some of the other universities that have similar programs like family and consumer sciences or other related things. So we are trying to reach out to all of the universities and work in partnership with them to get people in and to have internship opportunities so they get a sense of the work before they actually commit.
Has it worked? I mean, have you got a response from that that's made a difference, or?
We have gotten more people. We're still struggling to keep them. And I will tell you, I call people myself. That's the last group that we lost so many who say, I will pay it back because I can't do this work after they finish the internship. And I have called them, and what I hear is, it is the amount, the sheer volume and liability and responsibility that goes along with the work, and with the sheer volume, I can't do this. That is the most common thing I heard.
So, and it's always going to be a tragic situation. This job is this is a rough position to be in. It's always going to be that way. So what,
So I'll tell you some
as you
things
say
that
that,
I
I'm
think will
looking
help.
at 2017, the salary was 38,000. 2022, the salary is 48,000, and the attrition rate, the percentage of vacancies went from almost 5% in 2017 to almost 25% in 2022, when it's 10,000 more a year. So it's like we accept it's not the money. So to me, then you've got to totally rethink.
That's exactly right.
And have you all looked at what other states are doing where you have a different method of delivering the services
Yes.
altogether?
Yes.
Okay, what do you
Yes.
think about
So
that?
one of the key things that makes a difference is we're looking at 24/7 shifts. So I know Senator Jackson has brought this up. Others have brought up the idea of 24/7 shifts. Initially, we were thinking we cannot get enough people for the day shift, much less think we can cover night shift
Right.
and an overnight shift. But the more we have researched it, the more we've come to the conclusion that if we don't do that, we may be having to recruit a whole different group of people, but if we don't do that, we will never give people work-life balance. People have to know that they can stop at some point and leave. Right now, if you're working on a case, you just, at 5 o'clock, call somebody else to go see about your child from daycare or whatever else you had to do, because you cannot leave. And so having a schedule where you have an overlap piece during the day and people can hand off something in certain instances, or even scheduling your visits later, because most foster care visits will take place after school, so scheduling your hours later, working that later shift would be helpful. And then having an overnight and weekend shift, so an 8P to 8A and weekend. That is one thing that has helped in other places. And so we are working really hard to get something in place in New Orleans and Baton Rouge. We think those two places can easily justify it, and we think we can get a pool of people that, we're hoping to get a pool of people that can fill that.
And you think that would serve a twofold? I mean, you would give a little ease to the people, but you would also, frankly, it sounds to me you would respond
Have better
better
coverage. Yes.
to a call that came
That's
in
right.
the middle of the night.
Yes.
Okay.
Another big thing that has made a difference is who is the team comprised of? So right now, you have caseworkers going out by themselves on a case, on investigations. They will call the police and ask them to come with them if it's they're going into an area that they're concerned about. And the police, while we have great relationships, they come when they can, but they have challenges themselves. And so oftentimes we end up having to go by ourselves. There are models, and again, Texas is one that has recently done this, and we've been working with them on it, where they have started hiring their own police officers, and they embed them into the child welfare teams. So they have retired law enforcement, they call them special investigators, and they are embedded into the team, and they go out with the caseworkers. The other piece that's needed to that is a medical component. The things that we are having to make decisions about on the spot, substance-exposed newborns, and just some of the other issues that we're seeing, requires a level of knowledge and competence that our staff just coming in don't yet have, and frankly, it could take it's a whole scope of work in and of itself. You know, I recently spoke with someone from LDH as we were working on some of the plans that they were helping us with around training, and I said, what do you help me think about the qualifications for someone going out to see the substance-exposed newborns and assess those? And she said, well, a nurse with neonatal experience and, you know, the whole 9 yards. We don't have that. And she acknowledged you're not going to get a team of those. So how do we get a handful of them and have them as part of a team that provides supervision to a much larger group? Because I can't go out on everyone. So we've had a very, very productive meeting with East Baton Rouge Sheriff's Office, and they are excited to try and partner with us in that effort. And the law enforcement that we would bring in does not take the place of them. So they don't go out with a gun and a badge. They are there really from a couple of different aspects. One is the detective mindset. So they are helping us understand some of what we're looking at, what we're looking for. They understand the drugs on the street and what our caseworkers might not recognize. They understand what information is available to law enforcement, and so they're able to liaison with the local office and get the kind of information that's needed. So it brings a whole different element to the team. That shared information, real-time shared information, is critical to us making better
And
decisions.
what time frame are you looking at of any of this?
Well, we
being put
actually,
in
before the end of the month, we're going to see East Baton Rouge Sheriff's Office has talked to us about maybe being able to be housed, this team housed at the Family Justice Center over on Government Street. And so we're going to do a walkthrough with them and see if we can get something.
And that would be almost like a pilot program where you'd be
Yes.
using it in
Yes.
Baton Rouge first?
That
to
would
see-
be, yes, that would be pilot for that full team. The other part, though, that is more doable everywhere is to have a multidisciplinary supervisory team. So as we talked about, the workforce has changed. We're getting people in for a short period of time. They're not staying in these jobs for 30 years anymore. And so how do we use the skill set of those who are coming in to our advantage? And so they care about people, they want to work in a people environment, but they're not staying long-term and not even staying long enough to where their experience is sufficient for the decisions that they're being asked to make right now. And so if we use them for their skill set of going out and gathering information, they're great at finding people, they're great at internet searches, they're great at being able to get information, and let them bring that back to the team and have a team that is multidisciplinary, so law enforcement, medical, substance abuse counselors at the table, our social worker, obviously. That team can make much better decisions. And so that's the other
Thank you.
piece of it.
Thank you, Mr. Chairman.
So on that same note, and I'm going to turn over to Senator Fessy, but on that same note, and I was going to bring that up later, but it seems like you're going to be doing almost like a contractual relationship with those departments to see if you can get that. So right now, you have 400 vacancies, is kind of what I'm hearing. Has there been any talk about a public-private partnership with, here's your policies, here's your procedures, an emergency contract would go out to, it's being done a lot in the United States. I mean, right now, the federal government's doing a lot of that on the immigration issues. They're doing public-private partnerships with, here's the deliverables, here's what you need. Many states did this during COVID-19. It's like we don't have enough people to man all the vaccinations and the screening, so a public-private partnership emergency contract was issued to fill those voids. So with your policies and procedures well-defined, the mission well-defined, have y'all looked into maybe that type of situation where you put out an emergency contract and you start filling some of those voids to take the workload off of your key people?
Yes, sir. We are in the contract writing right now in Baton Rouge with the Family Services of Baton Rouge to take the lower risk families, that they will take that body of work away from our staff. right now, if you think about the continuum of child welfare, you have the call center that takes, the centralized intake that takes the call, and then you have the investigation. And then for those children that we don't immediately put in foster care, that we want to stabilize them in their home, we have that bucket of work is called family services. So within the family services bucket, you have some
that these are the deliverables we need over the next amount of time, because it seems like you have to stop the bleeding, and it looks like these pilot projects are short-term. You're going to see if they work, but you have to have some deliverables, and it's happening in other states. I mean, they're doing it right now for monkeypox, for COVID, for immigration, oil field safety. It looks like these companies can respond to RFPs. Have y'all looked into this and seeing like it can be a 1-year contract, a 2-year contract, but it could be enough to just stop the bleeding?
Yes, if you don't mind. I'm Terry Ricks, Deputy Secretary of the Department. Thank you for that. And I did want to just put on the table that the entire department, leadership, not just child welfare, we're working all together with child welfare. Our plans are immediate, short-term, and long-term. And in each of those buckets, there are multiple efforts that we're taking, basically leaning out the process to determine what needs to be shored up at every part of the process. From the time someone walks in the door, for us, that means probably a phone call, right? That says that there's a child in need of care. From that decision all the way to putting that child back into their home, we're looking at the entire process. During that time, we're identifying opportunities for public-private partnerships, working with other state agencies, even using some of our staff a little differently to shore up some of the work that is needed in child welfare, for example. I'll give you one example of that is the consideration to contract out home development. That is one part of the work that we do that would free up 50 to 75 TO that would move to another area. These are people largely, there's some vacancies in there, but they're already trained, right? And so we would put them back into areas that would make sense for them to do more of the critical work right now. So that's an example of what you're saying. And then also with the security, we've worked with, and I want to make sure that you guys know that sort of kind of goes without saying, but I want to make sure that we say we're working with the commissioner, working with the governor's office, working with civil service to make sure that we have the ability to quickly pull on people in contracting circumstances, as well as even some critical hires that we would be able to catch immediately and move into positions for the critical work. So we're working on what is the child welfare, the entire schedule need to look like so that we can both hire well. And one of the things I wanted to make sure that you realize, the difference in current pay, hiring pay, starting pay in 2022, that just happened. And so we don't really have all the outcomes from that yet, right? And so it's not exactly the same time period between, so we don't know how that's working yet. But we know that we have multiple inputs that we're working on. What helps an individual? What helps a team? What helps the entire organization to develop? We're looking at the processes, determining where we can get in with contracts, like you said, and because we're looking for better outcomes. In the end, that's what we're looking at, better outcomes. So we want to be able to provide back to you as we continue these conversations. Okay, this is what we looked at. I'll give you another example, another contract that helped immediately. Workers are coming in, they're removing children, but they still have to deal with the paperwork and finding a home. So we contracted with a local child care provider where those children can be cared for by a licensed provider while the worker can do their work. It's simple, but it has been effective, and it's been helping. The workers would say it helps. The other thing that I would say, just wanted to bring up, is that we're also contracting out an EAP, a program for the workers to be able to get some help with the secondary trauma that they are going through from doing this work. We believe that that will also help the staff from our conversations with them. We have not only increased, it's hard to do exit interviews, by the way. Sometimes people go, this is it, I'm leaving, bye-bye. They don't really want to have a conversation with you. So we're doing stay interviews so we can understand from people who are in those seats how to keep them in those seats. And that's happening on both sides of the House. And then,
So not to cut you short, but there's a lot you're throwing at us that seems like it's really good stuff. Can you provide for Ms. Cannon and Ms. Peck exactly what your short-term, long-term goals are? And each goal, what would it accomplish?
Yes,
would
sir.
it fill 30 slots? Would it fill 50 slots? Would it help for short-term? Where we're at with training. Can you provide that for us?
yes, sir.
Okay, because it's a lot coming at us at one time. So
Yes, sir.
I think that would help us to understand. But just to get to that point, and I'll open up some more questions, but get to that point is you've got some short-term, long-term plans. Some of it could be from outsourcing. Some of it could be from a team approach. That team approach would bring in law enforcement, medical disciplines, but as you projecting this, project what your outcome would look like.
Yes, sir.
If you could do that for us.
Absolutely. One other thing I want to just put on the table, since I have the mic for just a little
Sure.
bit, is what you guys have been bringing up with regard to how people feel at the job. And so I think this is a very courageous step on behalf of the Secretary, right? The executive staff, we made a step to open up a diversity, equity, inclusion, and belonging council and an office. And so the council is made up of employees from around the state, all the different program areas, and we have a staff that is looking at various outcomes and outputs. What are we doing? What are people saying? And so we opened up an entire line of, if you don't feel like you can talk to, your manager for some reason, what is that? Why is that? So we opened up another line of communication through the Diversity, Equity, Inclusion, and Belonging Office. With the EAP and the DEIB is what we're calling, and the council, we've been able to pull in more information from the staff to help us understand what they are saying. And one person, I was actually at the council meeting, said, you guys just need to know that not everything that you're pushing down is getting all the way through, down to, to the all the way to everybody, right? So somewhere in the middle, management maybe, there's a breakdown in certain spaces, offices, or programs. And so one tool that we've recently been using is basically called sort of an administrative office review, where if we're getting more than one or two comments that there's a problem in the office, then we send a staff of people who are especially trained to go in and ask more questions and understand what is going on in that particular office. One such administrative review recently yielded that there is a person really causing havoc, wreaking havoc in the office. And maybe the manager didn't know how to handle that. And so we saw the assessment is there is a problem here with leadership and training, and we need to change that. We need to address it, and we need to provide more supports. And so as we have gone through this process, we've learned, because when we walked in the door, we heard the same thing you guys are saying to us now, the morale is low. We got that in 2016. So we have taken multiple steps to open up the spigots and allowing staff to come and talk with us. We've increased the training that we have for everybody regarding things like biases, opening up opportunities for them to understand really what not just management is, but what leadership is. And the last thing I'll say is the example of that is a new program. It took us a couple of years to get this through because it is a curriculum. We had to go through the entire process of going through a curriculum. But 2 weeks ago, 12 supervisors and managers in child welfare graduated with a certificate from Grambling State University in leadership. And each of them would say that it was really a life-changing experience for them to be able to stop and focus on how I need to change as a leader and how I can influence others in the agency. That program really will help. Now you've got 12 people who took the time, their own time, but incentivized to become a better leader. And I think for too long, we had lots of managers who didn't get the training to actually become leaders. And we are trying to stem that tide as well and bring more leaders into the work. But another program that was a partnership with the universities. We have several partnerships with the universities. One of them is with LSU's Leadership and Human Resource Development. They are coming in to do an actual research project on the turnover to give us more evidence-based data to make decisions with. Thank you.
Once again, any of those initiatives, please provide that for us. Senator Fessy and Senator Cortez hit y'all button all at the same time, and in baseball, the tie goes to the president. Mr. President?
Thank you, Mr. Chairman. I won't be long, Senator Fessy. First of all, I want to thank you for acknowledging the challenges of the named storms, the hurricanes, the pandemic. Many of us, well, all of us here, have staff members that work for us that how they're still around after the pandemic, and the amount of I'm going to say just verbal abuse they had to take at our district offices just because people wanted change and we couldn't affect change. We're the policymakers. The executive agencies actually do the work. It was very difficult on everybody. But I want to talk a little bit about some of the other areas where there have been challenges. Senator Pope and I have worked on some things relative to education and teachers. There's been a teacher shortage, but I happened to be reading a 1967 newspaper. It was the year I went to first grade. Guess what? Front page, teacher shortages. Teacher shortages are not new. They just happen to be in the news at the time and we try to work on them. So what do we do there? We tried to cut some of the red tape in the teacher programs. We tried to give those students who wanted to become an educator an opportunity to make it just as easy to get that degree, and I don't mean easy in lower standards, as it is to get an accounting degree or an engineering degree. Nurses. During the pandemic, every hospital told us they had a shortage of nurses. Nurses were quitting. They went and figured a way to hire and outsource traveling nurses. Teachers, they've been able to hire teachers, and they've been able to hire teachers since over the last 50-something years in shortage situations. I know that you have caseworkers and you have probably clerical workers. You mentioned a number of the difference. You have medical component. You have the law enforcement component, and I guess the questions, and these are somewhat. I'm asking these questions not necessarily for an answer because I think you all are going to know, but for the public at large, what is the educational requirement? What is the certification requirement of the different types of people you have to hire? What's the training requirement? How long does it take? One of the things we all participated in passing was something called the Foster Promise Program, which trains people that are out in a job to get a certification or a degree to improve themselves, and it's based on what employers need. In many cases it's EMTs and LPNs and RNs and things like that. So I guess from a structural perspective, and you talk about them getting overwhelmed with the amount of work they have to do, has there been any thought of looking into, okay, I could hire somebody that's more entry level to deal with this, and I could get him in the door, and I could train him relatively quickly and take the burden off of, and Senator Mills used the three of you are the caseworkers and the two of you leave, and now everything's on you. But could we get someone in there to take some of that burden? And I guess the most discouraging part, and again, this is from the policy-making side, we're on this side of the dais, is that if you have 400 unfilled TOs, then why are they unfilled? If some of these things could be done, why are they not being filled somehow, some way to relieve the burden on the person in the middle who's left there carrying the whole weight. So that's my question from a sort of global 30,000-foot view. If we know the problems and we know that there can be solved, then why aren't we solving them? Why aren't we getting people in the doors?
Well, I can start, and just want to say that you're right, and we have tackled them before, and now they are arising with a greater need. And so we will tackle it again, and some of the things that we've been talking about to be able to handle them, we are. And Senator Cortez, we do have a lower level position where someone can walk in with almost like basket weaving, right? And we can then teach them and train them and move them up through the series. We don't yet have a special entry rate for that person yet. That position is starting at 27 is hard. It's hard, 27,000 a year, so that one's hard to pull in. So our current conversations will hopefully yield exactly what we both want, and that is sitting with civil service and the commissioner, and then also doing some very specific and targeted outreach. And so one of the things that's probably one of the more promising things, again, as we talked about leaning out the process, is how do we get someone that we just met that looks like a right hire for us, hired more quickly and take some of the steps out of the way. We've identified that as one of the issues. Civil service identified that as one of the issues. And so we're happy to be planning right now some events that will allow civil service to be at the table with us, so that normally would take several weeks to process would happen immediately, so that civil services part in this is to determine that someone is actually qualified, which is, a defined term, which normally takes some back and forth, but doing some things with them. This happened also with LDH and also with OJJ and some other junctures that we can learn from, and so we are scheduling those to happen in September.
So one of the being in business, there was a popular book a number of years ago called Good to Great, and it was really one part that I took from it relative to my business was, did you take the bus? Yeah. So get the right people on the bus, and then as you're traveling, figure out what seat to put them in. And so the way I'm thinking this through and extrapolating it in your particular world is, you might bring someone in that's clerical on day one, but in 2 years they may be degreed in doing casework because they're passionate about it, and you got to get those people. And again, I keep talking about Senator Pope and I, but we both are former educators. Yes. You find me somebody who wants to teach school, and I'll hire them. And look, I taught school for a number of years, not as long as he did, but you don't want me back in the classroom. I mean, I'm 61 years old. I was passionate about it, and I still love kids, but I don't know that I could relate to them today like I could have a number of years ago. And my point is that if you get people in the door, the right people in the door, get them in the bus, yes, and then figure out where they can help your organization. And I know you're working on that, and I appreciate that. The last thing before I let Senator Facey take over is that many times we get, we need to have legislative solutions. And obviously we're a long way from going back into session. But to the extent that we can help from a legislative statutory, if you have a statutory hurdle in front of you, that we can remove a barrier that we can remove. And I know you're working with the other agencies that you need to work with. That's what we're here for, and again, that's why this dialogue is probably long overdue. But anyway, thank you for that, and thank you, Mr. Chairman, for allowing.
Thank you, Mr. President. Thank you for being here. Senator Fessy, it's your turn.
Thank you, Mr. Chairman. I guess where I'm going to start is, I want to tell y'all, I know y'all job is very, very difficult, and trying to figure out all the challenges such as hurricanes and COVID and everything we've been through. But one of the things of being in business pretty much all my life, I had to learn that we can have too many layers of management. And when you made a comment a while ago that some of the stuff is not trickling all the way down, so from the caseworker all the way to the top, how many layers of management do y'all have?
We're counting on our hands here.
So there are caseworkers, they have a supervisor, and there's a manager. So that's a unit that they work
Okay.
in. There is an area director who is over the entire region, and then there is a regional administrator that is over 3 regions. The reason we did that is because trying to standardize and make sure that there is high-quality, consistent practice across 3 regions was the most we felt like we could stretch them and still make sure that we achieved that. And so at one point, in the previous administration, there was only one person who was over the entire state. And it was just unmanageable to be able to get consistency across regions. Now we have divided it into 3 tri-regions, and there is one person over each of those tri-regions. So it's that one person on the tri-regions, there is one person for each regional office, and then managers and supervisors.
So we're looking at 5 to 6 layers of management by the time we get all the way to the secretary?
That would be right.
Okay. A number of corporations found that as the major failure because it wasn't getting down to the worker. And I don't know if Representative Hughes is kind of feeling or getting the word that I heard, but listening to him. And because I'm hearing we got a toxic atmosphere in the worker down at the lower levels. And so if that atmosphere doesn't trickle up to the top, so y'all know how to fix it, that's where we gotta learn how to fix that problem. Working in my business when I was up to 600 employees, there's no way I could know everything's going on, but I had to have the right people in place to make sure I found out what was wrong. And here, the person that's really doing the work is just being I felt not getting everything they need, and we're overworking them. And so, I'm hearing all these different numbers of how many cases they handle, and we really need to get down to the worker and make sure we salvage those, because I look at the turnover rate cost in 12 months to DCFS is about $24 million a year. I mean, if we could just cut that in half, the $12 million, the money is in the system. It's just not being utilized in the proper way. And I know I'm not telling y'all doing y'all job wrong, but we just got to figure out how to fix it. So so the other questions I got is what is the number of managers we have versus actual caseworkers?
A 5-to-1 ratio.
So you got 5 caseworkers
5 workers to a supervisor.
to supervise, but then if you
Supervisors
go
to
up the level, it's almost, if you go up 5 levels, you're almost 5 to 5. If you follow what I'm saying, I mean, in that particular one unit. So I'm just looking at that. What can we do to get the worker in a better atmosphere? Like President Cortez said, it's always about getting the person in the right seat on the bus. We can pile them in on the bus, but getting them on the right seat. So to get rid of this lower atmosphere until we fix that problem, and a lot of the things you say you got going on and that y'all putting together, putting a police officer, a retired police officer in situations such as what happened with Ezekiel. I mean, I watched a couple of videos of the neighbors recording when the police officers went out there, and it's chilling that if just a caseworker would have went out there, it would have been scary. So if that's the part of the toxicity that they're talking about, because they're having to go to to parents' homes that they get called on, and there's drugs and everything else going on. That's a scary situation. So I think we really need to look hard on how we're going to help that worker so we don't have that toxicity at that level. And I just see all kind of things that we need to fix when it comes to that lower level to make sure they have all the tools in their box. As me running a business, if I send my crew in the field and they don't have the right tools, we're going to fail every time. And I think that's what's happening. We got to quit failing. So I just wanted to get that out there that, talking to people that work in the field, it's, we got to get that atmosphere better. And if we don't fix it, we really doomed, because when they all, we got to get them to let them know that we want to back them 100%. And if y'all got any response to any of that, I'd appreciate it. Thank you.
Thank you, Senator Fessy, so much, and thank you for your support of your region. I know that our staff really appreciate you there and know you and know your name, and you know their name, and that's important to them. And I think many of the things that Dr. Hodnett and Terry have said are exactly aimed at that, having those administrative reviews in the offices to find out what's truly going on and where there's a toxic environment, having the ability to wrap the workers that have these high caseloads until we can get them down, because we will get them down, but until we can, to wrap them with the support they need to give them the tools to do the job. They need that medical advisor. They may need that law enforcement type presence. They need an on-call supervisor. Another thing that Dr. Hodnett brought to us from another state, when you were talking about when we look at states and where we see things that are doing well. We've pulled a model from the state of Idaho that's, I won't remember what it stands for, it's CCDM, but basically it's an on-call supervisor, so that if your supervisor happens to be carrying a case and you can't get to them right away, this is a supervisor that is on call, and you get an immediate feedback. You get the immediate support that you need. And then while you're talking to them, they're doing the data entry about the case, to Senator Cortez's point about having people that can do some of the work that bogs down the worker. So they're actually putting the data into the record while they're working with the worker. This is new for us. We started this,
7 months ago.
6 or 7 months ago, and it's showing great promise. We haven't rolled it out across the entire state. Dr. Hodnett will have to tell me exactly where it is, but we are in constant contact with our colleagues around the nation, and we are always looking for best practice and what other people are doing. Senator Mizell, you're very familiar with working with Texas for the human trafficking issues and trying to figure that out. So
as you implement those pilot programs from the other states, can y'all keep us posted on that? Because I think that helps both the committee, and it helps all of us to understand what's going on. And on that same note, do you have the technology that can integrate to make the system work as Idaho? Because usually when you come up with something new, you have to have the technology that it talks to everybody in the region, and it basically helps communicate better.
Right. So as
Excuse me, Senator, let me put...
And I got another thing to add is that the talking to the police officers and stuff, when they have to call into DCFS, it takes them, they're saying anywhere from 30 minutes to an hour to go through all the questions, and they don't have a lot of those answers because they're kind of in the blind of what's going on too. So what can we do? Like you're saying, if we get these assistants to go out, what can we do to save the officers time? Because they got a lot of other things to go do besides answer, a questionnaire. And talking to officers that were, going through some of these situations, I think we got to come up with something better way of doing that also, because they don't have the time with all the calls they have. They're overworked too. So we got to come up with something that it may be a 15-minute questionnaire or something that gets down to the nitty-gritty, and so then we can all make a decision and make sure we can cover everything. So that was something else, I had on my list that we needed to discuss.
When we met with the Baton Rouge sheriff last week, and he brought his entire team, and it was a really great meeting. That was one of their issues as well, that when we shifted we used to have every region had its own hotline number, and so when you called to report child abuse in Bogalusa, you would get something different than you might get in Shreveport or New Orleans. And so when the idea of centralized intake came in, it was to standardize the practice across the field. That's a good thing. One of the drawbacks of it is that you lose the local connectivity of, I know the staff in the region and I can pick up the phone and call this worker and tell her that I've got a bad case and I need you to come. And so we're trying to figure out what the best model is to keep our standardized, centralized intake process and still have a quicker connection between law enforcement, hospital, and on-the-ground workers, because that personal connection is really important. One of the things that we learned is, it's one of these, two sides to every coin. So if the local law enforcement says, I know that family, I know what's going on in that house, there's no need for you to come, that's good to have local knowledge. But on the other hand, to that, there might be a bias to that. And so you might not be making the best decision because of those biases. So we're trying to dance that dance of figuring out exactly what the right connection is. In Baton Rouge, where they have the Justice Center and we can be embedded with them, I think that'll really solve that problem. In smaller communities where there is no such organization or physical plant to do that, we're going to have to figure out what that is. Do we make that direct connection between the local manager and law enforcement so they don't have to go through the process? We've got to get the information that we get at intake. That's critical. We've got to know that. We've got to document it. We've got to be able to prove what we heard, how we heard it, when we heard it. Because if we don't, then you're going to come back to us and say, well, how do you know that case was called in? How do you know that that report was made? There's no documentation for it. If I can just pick up the phone and call the worker and the worker comes. So it's a complicated system to figure out, but we're working on it.
Okay, so because my thing is maybe you can break it down, or the police officer only has to do this and then it falls to the next one, and in that way, because some of them said they just not even going to call in. They don't have the time, and so that creates even a worse problem. So I'm just trying to get it out in the open. So I'm here. Need any ideas? We're all here, sitting here. We just want to fix it. We want to help.
Yes, sir. And we appreciate that sincerely.
Thank you, Senator Fessy. Senator Luno?
Thank you, Mr. Chairman. Madam Secretary, I had a conversation with one of those first-level supervisors that supervised five. I was thinking it was 6 people when we talked, but maybe it was 5. In any event, they were having some issues in a case I was involved in, and I talked to them about what was going on. And she said, well, we had a person that had been here a long time, but they retired, and we couldn't find anybody else to hire, so we divided up her caseload among others, and that created more problems for them, and there was an uptick in violence across the state, which created more problems for them. And she said, these people just burn out really quickly, and sometimes they quit that way. The reason I tell you about that conversation was that occurred in 1993. Those problems never go away. They come in cycles, and we're back in one of those cycles. Unfortunately, we weren't prepared for some of those things that came down because of a multitude of reasons. And some of those reasons include COVID. COVID was difficult for everybody, and it made your problems in your department exponentially hard. And when we have those things to deal with like that, we look to you and say, well, if it were a business, we'd do this. Well, it's not a business. Kids of the state are not a business. Can we learn some things from business about how we do it? Yes. I don't think it's unreasonable for an organization statewide to have the level of supervision or managers that you have, because the 5 people that are under that one supervisor, they aren't directly supervised by those other people. They look over the whole project statewide, and that's similar to what a business would do that's statewide, that has a presence in every parish in the state. So I don't know that that's an issue for us. I think one of the biggest issues you have, and that we have to figure out a way to address it, is staffing. Because I did have 2 people recently contact me. Both of them had quit the agency, and fortunately I was able to speak with one of them, and he told me that his biggest problem was that caseload piled up, and there kept promises being, we're going to hire other people, and we're going to get your caseload down. It never happened, and so I think that's a huge problem that we have. So what I want to know is, what can we do to help you with that? Is there something we can do, a short-term or a long-term fix through civil service, through the rules that you have to work under? Can we continue to do oversight committees where we bring specific agencies in here and ask them why they're not cooperating with you or doing what they can to help with this problem? Because this is the old, I think it was Hillary Clinton said, it takes a village. Takes a village. This is what it takes. You got to have somebody in all these different areas. What can we do to help you?
Thank you so much for that question. I think one of the first things you can do to help us is to help us recruit, to talk about this work positively, and to help us find the people. It's hard to recruit when all people are hearing are negative things. And that may sound, I mean that sincerely, because we are struggling to get people in the door, and we clearly have to get more people in the door. We're going to shift resources internally to meet the need. That's what we've been doing in Baton Rouge, because and we keep coming back to Baton Rouge, members, because Baton Rouge is the region that, and I use the term on fire. Baton Rouge is on fire right now. It was New Orleans 4 weeks ago, or well, not that long, 6 months ago. And it rotates, and it could be anywhere next. I remember just right as COVID started, it was the Alexandria region that was the region that was struggling the most. I don't know what drives those ebbs and tides, but because Baton Rouge is on fire, we have literally emptied out the state office to put people in Baton Rouge working there to carry cases and to pick up managerial duties, so that.
Let me interrupt you a second and ask you this. As far as pay and starting pay coming in, I saw something the other day that amazed me. I stopped by a fast food restaurant, and I walked up, and there was a sign on the door, and it said, hiring, starting pay, $20 an hour, burger joint. Can you compete with that?
We had a really hard time competing in New Orleans when McDonald's was doing a $10,000 signing bonus during COVID. So we are working very closely with civil service. We did get the special entrance rate that started in January. And so it's been in place now 9 months. They're doing what we're going to be talking to the commission tomorrow about, are some other things that civil service has done with them that has given us interim approval to do some additional pay on top of that.
So one thing I was going to suggest to you is, when you talk to them, we don't want anybody's hands to be tied. If there's something we need to do to put that in place, to authorize civil service or authorize the department, whatever it is, to do some short-term measures, come to us and let's do those in the interim. This committee could help you to do something like that. So that would be something that's important.
And Jaden, civil service is here if you would like to talk to them, because that was something that was important to our vice chair. She wanted civil service here for the committee. So we do have a representative here if you would like to talk to them.
Okay. I'll do that.
Didn't mean to cut you short.
That's okay. Just a few other things, but I would like to talk to civil service about that. One of the other areas I wanted to ask you about is COVID. Mm-hmm. How are we now with COVID as far as it directly affects the department? Are things getting better with that, that situation? I know we've had a spike in COVID again, but is that better?
We track that every day. We've had 786 cases so far this year. And that's just in DCFS. You know, across the state, I think the COVID numbers are pretty scary. I mean, we're up over 2,700-ish, and we've had at least a dozen deaths in the state.
Were the deaths, are you talking about deaths of children or deaths of
COVID,
people?
just COVID
COVID-related deaths?
Yes,
Okay.
COVID-related deaths. So there is an uptick. We are tracking it. In fact, one of our Renda's deputy that would have been here, that's our policy expert that would have been here today, is home with COVID. And so, yes, we are definitely seeing there was a big spike in the summer months.
Okay. One of the issues that I think we're seeing dealing with children's issues in every level across the state is the increase in violence from the parents, and not only the parents, but often the children. We've been dealing with a whole lot of that. Is that something that affects your department, and if so, what can we do to help you there?
That is one of the things, if you look at the graphs on the back of the one-pager that we gave you, the homicides in Baton Rouge, if you just look at that from 19 to 21, from 97 to 170. The drug overdoses, the drug-exposed newborns. So you may not all realize that when a baby is born to a substance-using mother, that's considered a substance-exposed newborn, we are required by law to see that child. That caseload has skyrocketed, and we have not kept up with the number of staff to meet that caseload. We live inside this work. Homicides, drugs, gun violence, the number of children in that number that Senator Fessy mentioned about the child deaths so far, the number of children that we have seen this year killed by playing with a gun is terrifying. And to think of the worker that had to take that case, how do you ever unsee that? And so, yes, sir, we live in the middle of this trauma, and this trauma is affecting our work, our workers, and our caseload.
I had lunch with the sheriff of Rapides Parish last week, and I have to brag on them. They made a bust, and they seized enough fentanyl to kill every person in Rapides Parish. Every person in Rapides Parish. One bust. So it is a problem that we're going to continue to face, and I wish I had answers for you, but I don't. You know, we gave you some more money in the budget this past year to try to fill some of these voids. I know that that's not the cure-all to this. I just believe in my heart that, not saying you don't need more funds is because of the things that we've been talking about, but I don't think that's going to be the cure for the problem. What I would like, and I know this is going to be a difficult question, and you may not, I'm not expecting you to give me all the answers today, but one of the things I would like you to come back to us with is some kind of systematic approach to it. And it's a moving target all the time. I understand that too. But tell us, come back and say, okay, in this issue, here's where we need help, and this is what you can do to help us. And whether it's funding or whether it's hiring, whether it's getting more people trained through the technical and community college system, which I'm a big believer in, whatever we need to do to help with that. Because this problem is not going to go away. Like I told you, I've had this same conversation, Mr. President, in 1993 when I was a young lawyer appointed to a case to represent a juvenile. And it's going to be an ongoing problem. It's going to come time. And you can't staff up for every one of these things. We realize that. But you know when we know that there are some problems that have to be addressed. Let us help you.
Thank you so much.
Thank you.
Senator Luna, just to answer your question about the $20, our incoming child welfare trainee with the special entry rates and all would be $17.55 an hour.
That's a little bit more stressful than working in a fast food restaurant, and that's the level of pay we're at. And look, it's difficult. I don't know I'm not nearly smart enough to have the answers to how we address that, but I mean that's that's obviously a problem we're going to have to address.
Thank you, sir.
Thank you.
Thank you. Thank you for the questioning. Madam Pro Tem?
Thank you, Mr. Chairman. I want to shift it a little bit. I mean, the reason the chairman and I spoke and started the conversation on this was the loss of life of children that were successive weeks. And we can talk about vacancies all day long, but in my mind, what I have not been able to answer is how a call to call intake was not answered. I mean, I understand we're 400 short. I get all that. But at the very heart of, I think, what we're all here about is I want to better understand when the hotline gets a call, and I know on your one-pager you mentioned you've made changes in centralized intake, and, you know, on the other answer to the questions, I see that there is the grading priority 1, 2, 3, 4. I want to understand what appeared to me to be what would be a priority 1 call coming from the hospital consecutively. What happened? And tell me how that's never going to happen again. So kind of.
Can I add to your question if you can? Because I did get to hear this in select committee when you went over from priority 1, 2, 3, 4 and what needs, the action steps need to take place. That was where I was going to go. So I was going to basically say, as you answer the pro tem's questions, let's just talk about priority 1, because the definition of priority 1 says the first face-to-face contact with an alleged child victims shall be made as soon as possible, but it must be within 24 hours of receipt of the report by the agency. The first face-to-face contact with at least one of the parents' caretakers shall also be within 24 hours. So talk about that. Talk about the questions that the pro tem, but also talk about the success rates of hitting the 24 hours.
So, to your specific question about how could it go unanswered, the initial information on the initial call, the first call that you're referring to, had some information that question the urgency of the response. And when you say, how could it not have been, I understand in hindsight looking at that and saying that. But there was a negative drug screen. There was no belief that it was necessary to call law enforcement. There were multiple things that there was a plausible explanation by the mother. There was no prior history. So there were multiple things that went into the decision on that first call. In hindsight, of course, we wish any risk we would have responded to. The second call was accepted, and the worker did go out, but was not, the mom was not home, was not able to make contact initially, made a phone call, was able to connect with her by phone and set up a time that she was supposed to go back and meet with her. Got another call, ended up having to go out on taking custody, staying into the night, which carried over to another case that stayed into the night, and she just did. She did not get back out there quickly enough.
So let me ask you, when that call is made, is the caller, anytime the call is made, outside of that actual event, is the caller given some number or something that verifies,
Yes.
okay, this information has been passed on?
Yes.
The caller is given a verification of some kind
Yes.
that the call was made?
Yes.
Okay. And is there a follow-up? I asked this in Senate Select Committee like a year ago. of the young lady that does the call intake. And her response was, no, is there a follow-up? And can I have some peace of mind when I take a call, if I'm your call intake person, that somebody's following up on what I just heard on my line? Because, if I'm hearing the trauma of whoever's calling to tell me that, and all I'm doing is passing it off, to me, it would be really frustrating not to know that action wasn't being taken on that situation. So is there a follow-through in the process that somebody knows that action's been taken on that?
So let me make sure I understand your question. So the intake worker takes the information.
Right.
Makes a preliminary recommendation, disposition, sends it to a supervisor. A supervisor validates the preliminary disposition. If, regardless of whether it's accepted or not accepted, it goes to the local office. And so the local office gets them. If it was not accepted,
At what point is it not accepted? Who in that chain does?
the supervisor of intake.
So that's when it's found not to be valid?
No,
Oh,
no,
okay,
there's a difference in those terms.
Okay, tell me
It's not
that.
accepted. Validity comes into play when you actually do the investigation and determine whether or not abuse or neglect, there's enough evidence to say that abuse or neglect has occurred.
Okay,
That's the
okay.
validity part
Okay,
of the
okay.
investigation. This is at the intake part. So it is determined that it meets the criteria. There is a caretaker that meets our
Right.
definition. There's a child, and it meets the elements of abuse or neglect, as in state law. And if that is if it does, it's accepted, it's assigned a priority, and it's sent to the local office. There's a person in the local office that's responsible for monitoring this queue and going through the intakes and assigning them to caseworkers in the local office. They're also responsible for looking at all of the cases that are not accepted to be a second layer of review and making sure that there's agreement with that. If they do not agree, if they think that the case should have been accepted and it wasn't, they will send it back up and say, reconsider this. We believe this should have been accepted. Maybe they know something about the family. Maybe there's something that they know, or just another layer of oversight to say, I got your back. Let's rethink this. I think maybe you missed something here, and they send it back. So that is another layer of oversight there. And then the worker goes out on the investigation from that
And all
point.
that would happen, is it set as a priority 1 at that point yet? Or are you
It's
still
set.
trying to decide if it's a 1 or 2 or 3?
The intake worker, and when the supervisor
She takes
verifies
the
it, they
information on the
make
call, she
decision.
determines a 1, 2, or 3.
Yes,
And then is decided where it goes from that point.
yes.
So, I see Senator Fazy's gone, but in the situation where the neighbor called with Ezekiel, that was what the news story said, that the neighbors had called. You don't have any
Do
record?
not have any evidence of receiving a report from a neighbor in that
Okay,
case.
okay. So,
We have searched our systems multiple ways, and we have found no evidence that we received a call from a neighbor.
okay, that's what so when you said modifications have been made to ensure what's
So a
been,
couple
what's
things.
been done?
One is now a manager will review every case that is not accepted. So it's another layer when they
Another
come
set of
on.
eyes.
When they come on to their shift, they will review the prior shifts, any case that a supervisor has determined did not meet the criteria, so was not accepted. They also review any case that involves a child in custody or foster care. So a child in foster care or foster parent. So they review all of those as well. That's just as routine now. I'm trying to think of the other things that they've done.
medical.
So we changed the policy to about accepting from medical providers. If a medical provider calls on a child 3 or under, we will accept that report. And if it involves
What would have made you why would you have to put a policy in? Wouldn't that have been an automatic,
No.
logical thing to do?
No, ma'am. There are situations where we receive information, and first of all, sometimes we receive information and it doesn't meet the criteria of a caretaker. So those would.
Oh, that's a different,
go to law
that doesn't fall
enforcement.
within children's, okay.
Sometimes it is, when you say a medical provider, it's not always, a hospital emergency room. You would assume those we would always take. But sometimes it's a doctor's office, a school nurse, who are all considered medical providers, and they may be telling us about a situation, but it really does not rise to the level of abuse or neglect for an investigation. And so in those cases, that's some examples that may not meet the criteria.
Okay.
By and large, medical providers, when they report, those cases are accepted. Medical providers, law enforcement, those two have the largest rate of being accepted.
And are your the intake people, are they employees? Are they
Yes.
contracted or?
No, they are
They're straight up
employees who have,
employees.
yes.
And are you short-staffed there?
Yes.
I think we've got that information on how short. But is that, are you seeing that as a problem, or are you, is it
It
been?
certainly is a problem.
mean-
If we really wanted to have something in, when you're saying, what would it take to significantly improve? When you think about it from each of our programs, more public awareness of child abuse and neglect and the reporting requirements. There is a flaw in the reporting requirements, really, in that a mandated reporter is obligated to report. But many times there are multiple mandated reporters at a scene. And one is assuming another one's going to report, another one's assuming another one's going to report. We don't really want 100 people to be reporting on that same thing. But there needs to be some way that if I'm the EMT who responded and the nurse is there as well, and the law enforcement is there as well, that if somebody's making a report, I need to know that they put everything in that report that I saw and that was necessary for the department to have. And that is a gap in reporting right now. We don't have a good process for that, so what happens sometimes is one person thinks, the law enforcement might say to the physician, I'll make the report.
Right.
Or the physician might say, I'll make the report. So we don't always get multiple reports from all mandatory reporters. Sometimes doctors, as Senator Fessy said, the wait time, sometimes they have someone call on their behalf. And the information that's provided oftentimes is not nearly as detailed or explained in the way that the physician would explain it, to help the worker understand the severity or the implications of what they're reporting. So that's another issue. And part of that is, the time it takes to make a report. And it just does. There's a lot of information that needs to be gathered. We have put the reporter portal so they can go in now. They don't have to just stay on the line. If it's not an emergency situation, they can go in and report on the portal. One of the unintended consequences of that, though, one thing that has been difficult is that oftentimes it's not complete information. And so when we return the call or try to return the call to get the complete information in order to make the right decision, you can't find him. So the police officer who submitted a report might not be on anymore, and he's not going to be on for 2 more days. Or the nurse got off of her shift, or the teacher is back in the classroom. So those are some challenges that we are constantly trying to work through. It helps having the portal, but it also is gives us some new problems.
So if the call intake line is busy, they can go to the portal if they're already a mandatory reporter?
Yes.
Only mandatory reporters
Yes.
can do that, okay. But if they're not a mandatory reporter and they're calling the call intake, they can't leave a message, I saw.
No, they can they can get a call back, and they keep their place in line.
So they can leave their number and get a call back?
They'll get a call back.
Okay, thanks.
But that would be one thing, is that, public awareness and then sufficient staffing where the wait time would be no more than 5 to 10 minutes. I mean, that would be ideal. It fluctuates, and the team is very good about calling people in quickly when the call volume goes up, monitoring it. They're very nimble about making adjustments, but sometimes you just don't have enough people to make that adjustment.
Well, I don't think, if it's feasible, people are going to wait. I mean, if they're committed enough to get the number and feel the burden to call about the concern about a child, they're going to wait. My biggest concern is that somebody goes out on the call, so. Anyway,
Certainly.
thank you.
And
Mr.
Senator,
Chair.
we have seen a big spike in the month of August, and that is normal. August and September are
Spike in calls? or spike-
I'm sorry, yes, a spike in
School,
calls.
because of school going back?
Yes, exactly. More eyes on the children.
Right.
Kids are going and getting medical checkups for school, and doctors are seeing things that are concerning and calling. And so there's always a spike in August and September, and we're hoping and praying that that goes down. But that definitely has impacted the call center and the response time from our agency.
The other area I will tell you that is promising if we put a real emphasis on it, and I know that the legislature appropriated funds for the early childhood comprehensive services. So it is there's a report from the National Commission to Eliminate Child Abuse Fatalities that outlines strategies that they believe are the most important strategies to have. And one of them is that anytime there's a report of a child under 3, that somebody would put eyes on them. Now, they recognize that the state agency does not have the authority to go out and investigate something that doesn't meet the criteria of abuse or neglect, but they recommend that there be some partnership with some sort of home health or some sort of home visiting program that someone could go out and visit the family. And so that is another area that we're looking at partnering. As part of Families First, we are implementing something called Child First.